So we're back with our women's health chat. It must be 12:30 on Monday. And today I want to talk about weights for cardio health. And also in a separate side, weights if you already have heart disease. So until now, cardio and aerobic exercise has been the most promoted exercise of choice for providing heart health. So walking, puffing exercises, cycling, swimming, that sort of thing. However, lifting weights for less than an hour a week can also reduce your risk for heart attack and stroke by 40 to 70%. Boom, that's huge, right? So as well as it'll increase your functional strength, help work on bone density, increase your mobility for like squats and lunges and getting up and getting down and that sort of thing. So weights is really, really, really good for you, especially if you don't have heart disease yet, but you do have other risks. It can help negate those risks. So if this is you, we want to start lifting weights like today, maybe tomorrow. You want to do 20 to 60 minutes, but start at 20. Build to 60. You want to do it 2 to 3 times a week. Start with once a week, build to 3 times, and lift about 80% of what you could do once, which is about 8 to 12 repetitions in a row, and then you have a rest, and then you do it again. What 3 great exercises include, so I'll show you, this is a place to get started, right? You can do lunges, which I like because if you get good at these, they will help you get up off the floor, you know, later on when falls are an issue. We do 8 to 12. Try to keep alignment through your ankle, knee, and hip. If you see this sort of thing, it's not ideal. With any of these, it'd be nice to work with a personal trainer too, by the way, but I do understand not all of us have that luxury. The PowerPlate app has some great programs for strength training too. A shoulder press overhead, so breathing out, breathing in, breathing out, breathing in, and an upright row. They're a place to start. Okay, really simple exercises that'll start getting you strong from tomorrow. Now, once you've graded into your 20 minutes and you're doing 3 times a week, then we can start adding to that and progressing what you can do by adding whole body vibration. Now, with whole body vibration or power plate, every time the power plate comes up and goes down, there's a micro moment of ground reaction force, which is this, landing, which is controlling acceleration, which is strength. Okay, I know that was a long way of saying it. So you would do your lunges and then you would set this up to what you're comfortable on, and you can just hold, or even better, you can start to diversify where your strength is, so what your leg is able to do. You know, so this is basically a lunge, but I'm just hopping with my back foot. And you see the angle of the ankle, the angle of the knee, the angle of the hip changes as I go around. Then I would do the other leg with my lunges, and I would do my other leg on the power plate, hopping around, diversifying what my leg is capable of. Obviously, if your knee hurts, your hip hurts, maybe just do the ranges that don't hurt or twist your body up. Muscle pain is great, joint pain not so good. So to superset an overhead press, you want these muscles. So we would go this way, and then we just march our hands in all the ways the hands march. If that's too hard, you can march your feet. Okay, that's a little bit easier. It's actually quite a hard exercise, so don't feel too bad if you don't do any of this 3D work. And then the upright row, I just like to do dumbbells on the power plate, where we change our pulling direction. Okay, So all of these have a center point, which was the foot on the power plate. And then we were doing an arc-shaped movement around it. And what that does is it gives you strategies in your body beyond one perfect movement. You can do 27 perfect movements, which is important if you ever want to go skiing again, you know, or if you want to climb a mountain as opposed to a standard height step. You need diversity in your body. Now, if you already live with heart disease, there are some things we need to consider. So there was an issue with weights, and this is why it's not fashionable to recommend weights training if you have heart disease. There's an issue where when the muscle is held on, there's a rise in your blood pressure. But what they've found is that's not what happens. What happens is the blood vessels are constricted when the muscle's under load, but then as the muscle relaxes, it actually sucks blood into it. So it works like a pump, right? So we do want you to strength train if you already live with heart disease. But we have some recommendations, and most of them are you need supervision and a graded start. So let me read them out to you. Only perform strength training if you are asymptomatic or only mildly symptomatic. Begin strength training only after an initiation of aerobic training only. Okay, so adding strength training is a progression towards even better health. Start with single limb activities. So when I gave the example of the shoulder press before, it would be more likely to be, you know, a bicep curl or maybe a press, but unlikely to be overhead in the beginning. But that's why you need to be supervised. Set weight at a maximum intensity of no greater than 60% of your one repetition maximum. So without all the jargon, that means you can lift the weight 15 to 20 times. Okay? Lightweight does not mean easy, but if you are finding it hard and your muscles are burning, be careful not to hold your breath. Breathe out. Okay? That just stops the buildup of pressure. You want to train at your own pace, progress at your own pace, and take a break when you need it. And that's a nice way of saying there is no rush to get strong. Just being there and doing it is enough in the beginning. Your first few sessions should be medically supervised. Okay, so that's a physio or an exercise physiologist in the hospital or referred by your cardiologist, not just any run-of-the-mill personal trainer. You need to check in periodically for reassessment. That's just to make sure you're still okay, basically, that you're coping with the weights and it's doing what it's supposed to do for you. They want you recording your heart rate, both during and after exercise, so they can see your response to the loads. And perform strength training once a week for no more than an hour. Okay, no more than an hour, and that's enough. Once you've settled into your cardio and strength training programs, you can start supplementing with whole body vibration. So the vibration for our purposes today is a progression. It's an add-on. We do more with it and we build diversity into your body with it. Because it's basically cardio and strength all at once, all wrapped into one. If you want to get on the power plate before you do the weights, do your cardio on the power plate. Okay, so use it as a progression from walking. In short, all right, so as we get, if we're going to summarize what I've just said, basically, if you have heart disease or you're at risk of heart disease, you should be strength training. If you have it already, just grade into it slowly and under supervision. And do integrate whole body vibration because it does have a positive effect on arterial stiffness in especially middle-aged and older adults. So it is worth integrating, but it's a progression from your aerobic training or a progression and an add-on from your weights training. So you're going to go aerobic, strength, vibration, or you're going to go aerobic, vibration, strength. All right, I'll see you next week. Don't forget to send me your questions either as a comment on this video or in a private message, and I will see you same time next week.